Hi everyone, Dr. Emmy from Pain Free and Fit and Posturesize. Today, a great exercise for those of you with sacroiliac joint pain and dysfunction, the lateral wobble board exercise. Hope you enjoy. So today we're going to be using a wobble board for this exercise for sacroiliac joint pain. You could get a commercially made one like the fitter board that I have here that wobbles back and forth, or you could make one on your own, a little simple piece of plywood, a strip of 3x2 or 2x4, even 1x1, screwed or nailed into the bottom, gives you a little teeter back and forth. Sacroiliac joint pain, pain coming from the joint between the sacrum, that triangular bone at the base of our spine, and our ilium, or half of our pelvis, is a common problem not only for people who have been diagnosed with sacroiliac joint pain or sacroiliac joint syndrome per se, but also for a lot of people with spondylolisthesis and disc problems. Sacroiliac joints are a very common source of lower back pain in a lot of different diagnostic entities. One of the main findings that the literature is supporting is that gluteus maximus, your main buttock muscle, and especially the gluteus medius, that muscle on the side of your hip, are weak in people with recurrent low back pain and sacroiliac joint dysfunction. Hip hiking, where the hip comes up, has a tendency to rise up, shears and compresses that sacroiliac joint. And many times hip hiking, related to a leg that turns out in terms of posture and movement dysfunction, will have a tendency to cause more sacroiliac joint pain on that side. If you stand and you walk and you notice that one side of your leg likes to fall out more, either in normal posture, crossing the legs, perhaps it's a favorite leg to cross over the other, that tendency tightens the piriformis muscle that runs from your hip to your sacrum. It has a tendency to cause hip hiking as a result of the anatomical configuration of the hip joint, and that weakens the gluteus medius, causes excess compression on that side of the back, overactive quadratus lumborum muscles in the low back, and sacroiliac joint pain. Many people with sacroiliac joint pain have relief with manipulation. However, many times after you have relief, it's just a matter of time before the sacroiliac joint pain comes back. So if your doctor, your chiropractor, your osteopath, your physical therapist is not explaining to you post-manipulation what to do in terms of exercise, which leads us back to the wobble board training, you're missing a very big key component to help you overcome this chronic pain. So let's get started. We're going to use the wobble board in a side-to-side or lateral motion today. And the reason that is because sacroiliac joint pain many times is aggravated with hip hiking, with lateral stability problems. So what we want to do is we want to start sending through the use of a balance board a whole bunch of sensory input from our nerves, from our leg, from our spine, in our spinal cord, causing a reflexive motor or muscular pattern of holding that sacroiliac joint in a better position, avoiding hip hiking and avoiding the normal A to P or front to back malalignment of the pelvis. Now, if you don't know which way your sacroiliac joint, if you do undergo manipulation and get relief from it, if you don't know which way it's manipulated or adjusted, talk to your doctor, talk to your therapist, find out. For those of you who have a tendency, let's say my right side, that has a tendency for the pelvis to rotate backwards, okay, or an inferior, posterior, superior iliac spine, those people get manipulated and adjusted by creating extension, by taking something that's flexed and creating the extension motion. Sacroiliac joint pain motion is very small but very integral to normal function and feeling good. So that little tiny motion can make a big difference. We're going to plug that into this exercise. For those of you who have the opposite problem, again we'll talk on the right side, let's say you have an anterior tendency for your pelvis or your innominate bone to rotate, then you'll want to rotate that backwards. The manipulation that your therapist or doctor does always moves in a backwards direction into a flexion position. So let's keep that in mind. Using our foot placement on the board. If, let's say, my right side usually needs to be manipulated in an extension position, meaning it has to rotate into an anterior pelvic rotation, we want to make sure that that foot on that side is slightly behind, maybe an inch behind the other leg. Conversely, if my sacroiliac joint problem is such that I constantly need it adjusted in a flexion, okay, then I'll want to put that leg in front of the other leg by an inch as I stand on the board. What that does is it puts the innominate or the hip bones back into a slight normal alignment. if, and again, when you start this exercise, you're going to hold on to something for a little bit of balance. If I bend my knees and I consciously think of the muscular recruitment of those muscles to pull those pelvic bones back into position. So again, if I have my right foot forward, I'm thinking that that pelvis is going to rotate or tense in that direction. And the back leg, whatever side it's on, I'm going to think that that pelvic bone has a tendency to twist this way. So I'm just consciously, you're not going to feel a big muscle contraction in any one position, but I'm just consciously thinking with my knees slightly bent, less than a half an inch, I'm thinking that the side that my foot is forward is rotating pubic bone up, tailbone under, and the other side I'm thinking tailbone up, pubic bone down. That slight tension then, as I begin to balance on the wobble board, and again I can tap on and off for a little bit of balance, is going to help maintain a sensory input of nerves firing as I'm seeking balance. And again, you want to make sure that your amount of hold on or support is such that it allows you to sway no more than a quarter of an inch. If I'm wobbling more than a quarter of an inch, it's too dangerous. I'm not feeding the right information into my central nervous system to make these reflexive changes. I want a slight, less than a quarter of an inch of body sway. So if you need more, hold on, a couple more fingers to hold on, less, come down to a fingernail if you get really good. That's what you'll want to do. Quarter of an inch or less. So I'm maintaining those tensions with my pelvis as I maintain an upright posture, and any RPI or reverse posture isometric that's specific for me. Now, if you don't know what an RPI is, reverse posture isometric, go to either the Posture Size or painfreeandfit.com website. We have a free body analysis. Figure out your unique mechanical flaws. It's going to tell you if you need to, let's say, engage the multifidus muscle, decrease overcontraction of your right or left internal oblique muscle, avoid hip hiking on one side, avoid pelvic or torso rotation. We all, with lower back pain, sacroiliac joint dysfunction included, have unique posture and movement tendencies. You want to make sure your unique tendencies are being addressed in this exercise. You're correcting the tendencies that you usually go into. That, again, is feeding your nervous system the correct information in terms of posture, alignment, movement, proper muscular stabilization, muscular contractions, so that the reflexive changes when you're balancing are happening in the correct way. Anybody can stand on a wobble board and try to balance with abnormal posture. They're hip hiking, their rib cage twisting, pelvic going one way. The Leaning Tower of Pisa is on a big angle, but it's stable there. So you can stabilize dysfunction. You don't want to do that. That's training actually the wrong muscles, the ones that you're overusing already, to be more active. You want to train the underutilized muscles, your weak links, to do the correct thing. You want to train proper posture, proper alignment, proper joint stability. So you want to engage your RPI as well as this foot position and proper tensions, so that as you're on this wobble board, you're training all that sensory input into the right direction. The right muscles, the right alignment, the right avoidance of certain movements like hip hiking on one side. So getting back to hip hiking, if we're hip hiking, let's say on the right, that's our tendency, we're going to emphasize keeping that side open more than the other side. Again, you'll notice I just went off more than a quarter of an inch, so you need a little more tap as you do that. And you're going to be emphasizing all those corrections. Remember, you always want to be strengthening correct function, correct mechanics, not dysfunction and abnormal mechanics. Many times you go to the gym, you go to the rehab center, you see people working on instability devices like wobble boards, and they really don't know what they're doing. They're not making it specific for their particular needs. So any type of balance training, use your tailored custom corrections. You're going to get a lot more out of it. When this becomes simple and you can balance with hardly any tapping at all, then it's time to make it a little bit more difficult by closing an eye or two and tapping. Now, with the eyes closed, you're taking vision out of the equation and you're relying more on the sensory input from your spine, from your legs, and these fine motions are going to be even honed into a better reflex. So the idea of this exercise is we're taking a dysfunctional biomechanical aberrant situation that's placing stress on the sacroiliac joint, and we're driving in a lot of sensory impulses through balance with our correct tensions to create a reflexive muscular pattern to help hold the body in its corrected state, in its correct alignment, with the correct spinal muscles stabilizing and contracting. That, in the long run, is going to help hold your manipulation treatments. It's going to help prevent the biomechanical errors that cause sacroiliac shearing, A to P rotation, and other mechanical stresses on your lower back, and relieve a lot of that chronic sacroiliac joint pain. If you like this video on sacroiliac joint exercises, feel free to subscribe to our channel. We got a lot of great low back exercises out there. Questions or comments, write in. I'll do my best as always to answer them, and give me a thumbs up if you'd like to help me share this valuable information with others. If you're looking for a great program to help figure out what your unique mechanical errors are, what your posture, movement tendencies are, how to figure out how to not only analyze your body, but learn all the corrections for all your different posture and muscle asymmetries through specific custom-tailored exercises for you, check out our low back healing exercise program available at painfreeandfit.com. It's got all the analysis, corrective exercises. It shows you step-by-step how to self-rehab yourself, not only with these types of exercises, but strengthening, coordination, balance, stretching exercise, repositioning, pain relief exercises to get you back into the sports and fitness that you want to do without hurting yourself. I hope this lateral wobble board training for sacroiliac joint pain and dysfunction helps you with your chronic sacroiliac issues.